I'm a medical oncologist, and I've been working at Dana-Farber since I started fellowship in 2016. Uh, I very quickly kind of chose or gravitated towards GU medical oncology because of experiences I had during my training. And I think there's a lot of different ways that patients come to get diagnosed with testicular cancer. And it really ranges from people who this is the minority of patients, but patients who actually develop testicular discomfort and are found to have cancer. There's a lot of reasons you can have testicular pain, and most of them are not related to testicular cancer, but every so often that does happen. And that you go from there to patients who are just doing a self exam, even though that's not clearly recommended as part of screening guidelines. Patients will be, just in the shower, examining themselves and feel something abnormal or notice a change in size. And that'll get evaluated, and the diagnosis will come about. But there are, a number of patients who notice something abnormal but think it'll go away. And oftentimes things, you can have inflammation in the area and so on, and that can definitely go away. But sometimes, maybe because of some taboos about talking about your genitals and so on, may not be so kind of motivated to talk about it in general. And so we do see some patients who present later when they have larger masses or have developed metastatic disease. So it really does run the gambit. And I think the key point is that you should always feel free to kind of, as you're cleaning yourself, just notice any abnormalities that you notice anywhere on your body, really, and ask your doctor about it. It's much safer just to ask than not. So it definitely is a cancer that can affect patients of all ages. It just is most common kind of in the early teenage years to late 30s is kind of the most common time. It's the most common cancer in young men, essentially. However, there are patients, much younger than their teenage years who get it. There are patients in their 70s who get it. It's very uncommon at that age, but it does happen. A lot of times, as kind of I alluded to, there's not really any clear symptoms. So the minority of patients will present with some sort of testicular pain. That's actually not the most common way. The most common way that patients are diagnosed is that they notice something abnormal in size, or a lump or something like that. The other way that you could potentially come to healthcare is if you start to feel abnormal, if you're losing weight, if you're developing pain, if you're GI or urinary function is not the same that it always was. And then, you get evaluated and it leads to a diagnosis of testicular cancer. There are a lot of other things that can cause those problems, but that's another way. So, the important things to know as a result of that are that it's not always symptomatic, that it's okay to, monitor yourself and check yourself. It's not the most sensitive or specific thing, but it can be helpful. And if you notice anything abnormal, ask. If this is diagnosed because you're having back pain or troubles with your is something related to your abdomen, that's probably and it turns out to be testicular cancer, that probably is related to metastatic disease. But just for testicular pain itself, no, that doesn't mean anything. So the most common way it's diagnosed is when you feel an abnormality and it's found, and an ultrasound is typically done. And the ultrasound is a pretty good test for noticing some sort of abnormality that's not, typically there. And then what will typically happen is you'll have a surgery where a urologic surgeon will make an incision kind of in your groin area, roughly kind of up near your inguinal canal is what we call it, and we'll basically remove the testicle that way. It's a pretty well tolerated surgery. You usually don't stay in the hospital. You can have some soreness or numbness based on, kind of random factors, but then, most folks really recover pretty well, pretty quickly. And oftentimes that's it, that you'll have some scans, you'll have some labs done to make sure that there's no signs of spread. And if there's no signs of spread, then you'll be done. So you'll just have to kind of have regular surveillance to make sure it doesn't come back. And usually after 2 years, the risk of it coming back is very small. So that's one kind of category, is the localized. And sometimes though you either develop symptoms like in your back or somewhere else that lead to this diagnosis, unless things are kind of, a little bit, unstable where you're not feeling really well and there's a need to start therapy, you'll still have surgery and your testicle will still remove. That helps us understand what we're dealing with. And then depending on what you have kind of at diagnosis and how much the spread has been, there's a number of different therapies that could potentially be undertaken. Yeah, and just remember this is not, a clear recommendation from any kind of national organization or anything like that. But if one were to be doing self checks in the shower, which is the easiest time to do it, it's not just kind of washing the area. It's more of a actually palpating your scrotum, actually feeling your testicles specifically, not, too firmly or anything like that to cause pain, but really just understanding making sure that there's no bumps or lumps or that, the size is kind of similar to what you've experienced before. Testicles can often be different sizes. That's not necessarily something, it's more the change that you might wonder about. There's a family history component of it. So if you have a family history of testicular cancer, that does slightly above the average population increase your risk of getting testicular cancer. So there is a small hereditary component. So that's the sort of thing that you should know about. And when you're getting your health care, that should be something your doctor should know so they can tailor their, physical exam appropriately. And it's something you can just be a little more aware of than you might otherwise be. There was an increase in the incidence in kind of northern countries. So, like Scandinavia, especially, there was definitely over the last several years kind of an increased incidence for unclear reasons. And that seems to have tapered off a little bit, but really unexplained. And it's not as common in places like Australia, for example. So, something about the northern climate seems to be associated with it. Um, there's probably an environmental exposure component to it that we don't understand. I mean, if once you start to see enough patients, you'll meet people who all their friends have had testicular cancer. And these are kind of, groups of patients that you can't really pinpoint anything, but it's just something that we see sometimes. And so just because you have a friend who had testicular cancer doesn't mean they're going to have it, but you're going to have it, that is. But there are kind of these one-off associations that I don't have enough data to really draw a conclusive link on. The process that leads to the development of testicular cancer certainly seems to be related with decreased fertility relative to the average population. So we know that patients who are diagnosed with testicular cancer can have more trouble than average with conception and fertility. The usual thing to do is to discuss sperm banking even before having surgery. Um, there are a very small set of patients who won't have normal sperm production. And so trying to sperm bank even before surgery is something that can be considered. But we definitely recommend sperm banking prior to any chemotherapy or any surgery because those can impact sperm health for sure. But after you get through that and you've recovered from chemotherapy or you've recovered from your surgery to remove your testicle, the normal process is that if you're interested in trying to have children, you try the usual way. And if you're having difficulty after 6 months, then you can either rely on bank sperm or you can kind of enter into the fertility health process. I think, one of the challenges in this disease is that people do so well, and that's an interesting way of putting it. But what makes it a challenge is that it's hard to understand when patients don't do well. There's a small subset of patients who don't do well with this disease, and understanding that biology and how to better treat them is a real challenge.